Okay, good afternoon, and thank you for Philadelphia's response to COVID-19. Today, our speakers are again joining the briefing virtually to adhere to social distancing guidelines. And we will begin the briefing with some opening remarks from Mayor. Mayor, you have the floor.
Thanks, Mike, and good afternoon, everyone. Over the past 5 months, hundreds of thousands of Philadelphians have made a huge difference by following the simple rules of COVID-19. Wearing a mask, keeping a safe distance between themselves and others, and avoiding large gatherings. So it is really disheartening to see what we saw this past weekend and weekends before. A number of block parties and house parties taking place where too many folks were crammed into small areas, including indoors and not wearing masks. I do not know what they are thinking. I have no idea what they're thinking. Maybe they think they're invincible, that they're young and healthy, that no virus could knock them down. But no one is invincible in face of COVID-19. And these folks who are deciding to party and flout the rules also seem to forget that they can easily carry this virus back home. They can easily infect their family members, including parents and grands, or infect others that who have long-standing medical conditions or compromised immune systems. Look, I understand. I was young once too, believe it or not. And I know the desire of teens and young adults to socialize is a strong one. It's also been disappointing to see a number of older folks out at these gatherings also. They're full-grown adults and they should know better. But those who choose to take part in these parties are endangering themselves, their families, and their communities. They're endangering Philadelphia's ability to reopen safely and get back to normal, some sense of normal. They also know that not all young Philadelphians are doing this. In fact, probably the great majority of teens and young adults are wearing masks, avoiding parties, and being careful. But in a pandemic, all it takes is a few irresponsible people to mess things up for the rest of us. Those folks throwing these parties probably aren't going to listen to me. But if you're watching this or hearing my words, maybe they'll listen to you. If you see a party being planned, you can help by explaining the facts, by explaining the dangers, by convincing them that one night of partying is not worth the risk of infecting loved ones and community members. It's just not worth it. Of course, another challenge of this pandemic has been the economic fallout for so many Philadelphia families. In March, the city began its effort to provide supplemental food to residents impacted by COVID-19. Working in partnership with community-based sites, as well as Philabundance and the Share Food program, the city has since set up food sites across Philadelphia where families can access free and healthy food. Employees from our Community Life Improvement Program and volunteers have packed more than 32,000 boxes of food each week. To date, over 471,000 boxes have been distributed at food sites. At the same time, flyers with information regarding benefits, COVID-19 safety, and participating in the census have also been distributed to those receiving food boxes. This effort comes in addition to student meal sites at 80 plus locations citywide, where more than 5 million meals have been served to students. That's right, 5 million meals since March. I want to thank the city's partners, volunteers, and staff who have shown through these efforts that together we are stronger. Today, we're happy to announce that these food sites will continue to distribute free, healthy food to families throughout the fall. There are some changes to the schedule that are important to note. Next Monday, August 24th, will be the last day that the food sites will provide Monday distributions. The following Thursday, August 27th, will bring the launch of Thursday-only distributions. Moving forward, residents of all ages can pick up a box of food, and that's 1 box per household, on Thursdays between 10 a.m. and noon each week. ID and proof of income are not required. You can get more information, including the food sites, at phila.gov/food. That's phila.gov/food. And again, we thank all those who have donated food, goods, and their time to this important effort. Now, Dr. Farley with his update.
Thank you very much, Mayor. I have mixed news to report to you today. We are seeing an increase in the weekly case count, but we're seeing more testing and a similar percentage of people who are tested that are testing positive. Here are the numbers. Since this time yesterday, we've identified 84 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 32,432 since the beginning of the epidemic. Now, the past week that ended last Saturday, August 15th, by the date in which the test was run in the laboratory, we averaged 122 cases per day. That's an increase from 108 cases per day the week before that. If you've been following these weekly numbers, you may notice that last week I reported that number being slightly less. I think I said 105 or 106. Some of the laboratories send their data to us late, and so some of the past week results, it takes us a while for us to get all of them. That 122 cases a day is similar to the 124 cases per day we saw 2 weeks earlier. As we've seen in the past, the new cases are still predominantly younger people. More than 50% are under the age of 40. Last week, we averaged 4.0% of people who tested were testing positive. Now, we have some delays in laboratory reporting, particularly this week, and so that percentage may rise in the next few days. But it's very similar to the 4.1% that tested positive the week before that. We have 0 new deaths to report today. The total number of deaths since the beginning of the epidemic from coronavirus is 1,717. We're running just above 7 deaths per week, or just more than 1 death per day in recent weeks. We often hear about the deaths in batches, though, so we don't hear about them every single day. On testing, we have some good news on that. We are increasing the number of people who are being tested. We're over 3,000 tests in the past week. And we're seeing some improvements in the delays in reporting results of people who are being tested. Across all of our sites, the average delay now is 2.0 days between the time of the sample collected and the time in which a person has received the results. The one laboratory that has been delayed in the past, Quest, had a delay of more than 7 days. They're now 4.8 days, which is still too long, but it's clearly moving in the right direction. If people want to know where they can get tested, they should go to our website, www.phila.gov/testing. The map on that site there, which shows all the testing sites, has been updated to show more information. In particular, it now shows where children can be tested, because I know that many people have questions about where children can be tested. Across the region and across the state of Pennsylvania, like Philadelphia, case counts have not changed much in the past week. We appear to have stabilized. In the United States as a whole, case counts are still very high, but they are declining, decreased about 16% in the past 2 weeks, according to data as tracked by the New York Times. So that's where we are with the epidemic. I thought I would take some time now to just update people on where we are with vaccination. There really is exciting progress on vaccination. Vaccines are now being tested. Now there are nearly 40 different vaccines that are being tested on humans. 3 of those that are the farthest advanced in the testing process are now being tested for safety and effectiveness in tens of thousands of people. One vaccine made by the pharmaceutical company called Moderna started their trial, their last phase trial on July 27th. They're giving the vaccine to 30,000 people across 89 different sites in the United States. Another vaccine made by a company called BioNTech, which is a German company, also launched their trial on July 27th. They hope to vaccinate 30,000 people in the United States, Argentina, Brazil, and Germany. And then there's the vaccine developed by the University of Oxford and now working with the pharmaceutical company called AstraZeneca. They have started their last phase trial in England, India, Brazil, and South Africa. And while that trial goes on, they are optimistic enough that it's going to be shown safe and effective. The production of the vaccine has already begun. Now, in addition to those, there are 2 other vaccines that were developed by Chinese companies that are in their final trials in Brazil, Indonesia, and the United Arab Emirates. And while this is all going on, these very important studies to show the safety and effectiveness of vaccines, recently the Russian government announced that it would start using this vaccine in October without adequate studies on the safety and effectiveness. The Chinese military in China may be doing the same with a very similar vaccine. Now, using a vaccine that has not been adequately tested to a general population is something that we don't do in the United States, and I don't think anyone should do. People should not be given a vaccine outside of a research study unless it is proven to be safe and effective. Here in Philadelphia, we will wait until we have those studies to demonstrate that vaccines are safe and effective. But I am optimistic. I do expect that we will have a vaccine that is proven safe and effective to offer sometime in the first few months of 2021. We may, in fact, have more than one vaccine at that time that we could be using. Now, as we approach our thinking about delivering vaccine to people, I've heard 2 concerns that are to a certain extent in conflict with each other. First, I've heard concerns that more people will want this vaccine than can get it. Then I've heard that people will be afraid that the vaccine is not safe and they won't be willing to get it. To a certain extent, those 2 concerns will actually balance each other out. There's no question in the beginning, with whatever vaccine is first proven to be safe and effective, there will be limited doses available. And so we will set a priority for who gets those vaccination on the people who need it the most. so that we can save the most severe cases and prevent the most deaths. Now, there are already national expert groups that are looking at this to make recommendations on who would be the highest priority groups. And there'll probably be something along the lines of this. First, people who are medically vulnerable, such as elderly people, people with chronic medical conditions, for example, nursing home residents. The second group would be people who might spread infection to those medically vulnerable people. They're caregivers, for example, the medical staff at nursing homes and medical staff at hospitals. Now, that's what would happen at first. Then, as more doses become available, the vaccine will be opened up and made available to others at low risk and ultimately everyone. But because the virus also affects minority populations harder, at every step, we will make sure that they're particularly available to African Americans and other groups that have been most impacted by the virus. So how and where will we offer the vaccine? Well, likely it'll be through a combination of sites, nursing homes, doctors' offices, pharmacies, community clinics, and even freestanding vaccination sites. The first vaccines will likely require 2 different doses, and that will require tracking of those doses in individual people. At the same time, we need to track the doses of the vaccine itself because we don't want to waste any vaccine when it's going to be in short supply at the beginning. So to do that tracking, any site that's offering vaccine will need to be connected to our central Philadelphia immunization registry. That's an electronic computer database of vaccinations of Philadelphia residents. It's in place now. We're using it for other vaccines now. We can build on that. We're beginning now planning on how to connect those sites that will be offering the vaccine to that immunization registry if they're not already connected. Now, there's much to be worked out, but still, it's exciting to be thinking about through this right now because ultimately this is the way to end this epidemic. In the meantime, let me remind everybody that the best tools we have, the ones we have in front of us right now, using masks. To remind people, everyone should be wearing a mask when around other people. The mask use is important now as it ever has been. The second thing is to remind people that this virus is particularly risky to medically vulnerable people, people over the age of 65 or people with chronic medical conditions. If you have those, you should stay home as much as possible. Avoid contact with your relatives and caregivers who themselves are out and about and might be bringing the virus into your home. If you need to be exposed to those people who are out and around the home, that are out and about, make sure that they're wearing a mask and you are wearing a mask. More information and all of our data is at our website, www.phila.gov/testing. www.phila.gov/COVID. Thank you.
Thank you, Dr. Farley. And now we will move to Armando for the Spanish language translations of the mayor's and Dr. Farley's comments.
Palabras del alcalde Jim Kenney para el martes 18 de agosto del 2020. Durante los últimos 5 meses, cientos de miles de habitantes de Filadelfia han marcado una gran diferencia observando las simples reglas para combatir el COVID-19. Usar máscaras, mantener una distancia segura entre ellos y los demás y evitar las reuniones sociales. Así que fue realmente desalentador saber que este fin de semana pasado se realizaron una serie de fiestas en las calles y reuniones sociales en casas a las que muchas personas asistieron sin usar máscaras ni respetar la distancia social. No sé lo que están pensando. Tal vez piensen que son invencibles, que como son jóvenes y están sanos, ningún virus podría afectarlos. Pero nadie es invencible ante el COVID-19. Y esas personas que están decidiendo festejar y desobedecer las reglas también pueden parecer olvidar que pueden llevar fácilmente este virus a sus casas. Allí pueden infectar fácilmente a los miembros de sus familias, incluyendo sus padres y abuelos, o infectar a otras personas que tienen condiciones médicas de largo plazo o cuyos sistemas inmunológicos están comprometidos. Jóvenes, yo lo entiendo. Yo también fui joven alguna vez y sé que el deseo de socializar de los adolescentes y los jóvenes adultos es fuerte. Pero también ha sido decepcionante ver a varias personas mayores en estas reuniones. Son adultos y deberían comportarse mejor. Pero quienes eligen participar en estas fiestas se ponen en peligro a sí mismos, a sus familias y a sus comunidades. Y también están poniendo en peligro la capacidad de Filadelfia para reabrir de forma segura. Sé también que no todos los jóvenes de Filadelfia están haciendo esto. De hecho, probablemente la gran mayoría de los adolescentes y adultos jóvenes están usando máscaras, están evitando las fiestas y están teniendo cuidado. Pero en una pandemia todo lo que se necesita es que solo algunas personas irresponsables arruinen las cosas y justos paguen por pecadores. Probablemente la gente que organiza estas fiestas no me va a escuchar, pero tú, si estás viendo esto o escuchando mis palabras, tal vez puedas llevar a tus amigos a la reflexión. Si ves que algunas personas están planeando una fiesta, por favor, explícales los peligros que acarrean. Ayúdanos a convencerle a tus amigos de que una noche de fiesta no vale el riesgo de infectar a los seres queridos y a los miembros de la comunidad. No vale la pena. Otro desafío de esta pandemia han sido las consecuencias económicas para tantas familias de Filadelfia. En marzo, la ciudad comenzó su esfuerzo para proporcionar alimentos complementarios a los residentes afectados por la crisis del COVID-19. Trabajando en asociación con sitios comunitarios como Philabundance y el programa Share Food, la ciudad ha establecido sitios de alimentos donde las familias pueden acceder a alimentos gratuitos y saludables. Los empleados de nuestro programa de mejora de la vida comunitaria y los voluntarios han empacado más de 32,000 cajas de alimentos cada semana, y hasta la fecha se han distribuido más de 471,600 cajas en los sitios de alimentos respaldados por la ciudad. Al mismo tiempo, también se han distribuido a quienes reciben cajas de alimentos volantes con información sobre beneficios, seguridad en los tiempos del COVID-19 y su participación en el censo del año 2020. Este esfuerzo se suma a los sitios de comidas para estudiantes en más de 80 ubicaciones en toda la ciudad, donde se han servido más de 5 millones de comidas a los estudiantes. Y usted escuchó bien, más de 5 millones de comidas que se han servido a los estudiantes desde marzo. Por esto quiero agradecerles a los socios, voluntarios y al personal de la ciudad que ha demostrado a través de estos esfuerzos que juntos somos más fuertes. Y hoy nos complace anunciar que estos sitios de alimentos continuarán distribuyendo alimentos saludables y gratuitos a las familias durante el otoño. Sin embargo, hay algunos cambios en el horario que es importante tomar en cuenta. El próximo lunes 24 de agosto será el último día en que los sitios de alimentos proporcionen distribuciones los días lunes. A partir del jueves 27 de agosto, la distribución de alimentos será solo los jueves. En el futuro, los residentes de todas las edades pueden recoger una caja de comida por hogar los jueves entre las 10 de la mañana y el mediodía todas las semanas. No se requiere identificación ni comprobante de ingresos. Puede usted obtener más información, incluyendo la ubicación de los sitios de alimentos, en phila.com/food. Y nuevamente, les agradecemos a todos aquellos que han donado alimentos, bienes y su tiempo para este importante esfuerzo. Muchas gracias. Y esta es la actualización en materia de salud para el día martes 18 de agosto del 2020. Hoy vamos a presentar noticias mixtas. Ha habido un repunte de los casos semanales, pero también una disminución pequeña en el porcentaje de casos positivos. El día de hoy reportamos 84 nuevos casos con un total de 32,432 casos acumulados. La semana pasada, que finalizó el día sábado 15 de agosto, teníamos un promedio de 122 casos diarios, un aumento de 108 casos diarios en promedio de lo que habíamos reportado la semana anterior. Los nuevos casos se están presentando entre los grupos jóvenes, es decir, un 59% de los casos entre los menores de 40 años. El promedio de pruebas positivas es del 4%. Ha habido algunos retrasos en el reporte de casos positivos, así que podemos esperar algunos aumentos. La semana anterior habíamos reportado 4,1% de casos positivos. Y hoy, felizmente, no reportamos fallecimientos por la COVID-19 en la ciudad. El total acumulado de muertes por la COVID-19 es de 1,717 personas. Reportábamos 11 fallecimientos la semana que fue del 26 de julio y 6 muertes la primera semana en agosto. Probablemente reportemos más muertes previas debido a los retrasos en la recepción de los datos. Respecto a las pruebas, estos números van aumentando. Estamos administrando más de 3,000 pruebas a la semana y ha habido algunas mejoras en la recepción de los resultados por parte de los laboratorios grandes. En promedio, los resultados se reciben ahora a los 2 días. Quest está enviando sus resultados entre los 4 y 5 días tras administrar la prueba. En cuanto a la región y al resto de Pensilvania, el conteo de casos no ha cambiado durante la última semana. En relación a los Estados Unidos, el conteo de casos todavía es muy alto, pero está disminuyendo en un 16%, de acuerdo con el New York Times. Quisiera hablarles ahora un poco respecto a las vacunas. Se han realizado ya cerca de 40 pruebas en seres humanos. Los laboratorios más avanzados son Moderna, que inició su fase del 3, la fase 3, el día 27 de julio. Las pruebas se han administrado a 30,000 personas en 89 sitios a lo largo de los Estados Unidos. BioNTech, la fase 2 de la tercera ronda de pruebas, también se inició el 27 de julio y hay 30,000 sujetos de prueba en los Estados Unidos, en Argentina, Brasil y Alemania. Se han iniciado en Inglaterra, India, Brasil y Sudáfrica, y la producción de la vacuna ya ha comenzado. Hay otros avances de laboratorios en China que reportan el inicio de la fase 3 en Brasil, Indonesia y en la Unión Europea. El gobierno de Rusia anunció que comenzaría a distribuir la vacuna en octubre, pero sin contar con los estudios adecuados sobre seguridad y eficacia. Las fuerzas militares chinas podrían hacer lo mismo con una vacuna similar. Nosotros no vamos a hacer esto en los Estados Unidos. Las personas no deben vacunarse contra el COVID-19 a menos que sepan que es una vacuna segura. Los expertos indican que las vacunas probablemente estén listas en los primeros meses del año 2021. Respecto al tema de la vacunación, hay dos problemas. Hay mucha gente que querrá vacunarse, pero también habrá mucha gente que tendrá miedo y no se vacunará. Tenemos que balancear esto. Al principio tendremos dosis limitadas y se establecerán prioridades para las personas que más lo necesiten. Los expertos nacionales están haciendo recomendaciones para establecer los grupos prioritarios. Las personas vulnerables o con condiciones crónicas, por ejemplo, los residentes de hogares de ancianos, y las personas que puedan propagar la infección, por ejemplo, los cuidadores y el personal médico. A medida que más dosis estén disponibles, se abrirá la vacunación a personas de bajo riesgo. Debido a que el virus afecta más a las poblaciones minoritarias, en cada etapa del proceso de vacunación nos aseguraremos de que esté disponible para las comunidades afroamericanas y para otros grupos que han sido los más afectados. ¿Cómo y cuándo ofreceremos las vacunas? A través de una combinación de centros, es decir, hogares de ancianos, consultorios médicos, farmacias y centros de vacunación comunitarios. Las primeras vacunas generalmente necesitan 2 dosis y vamos a monitorear la administración de estas dosis en los individuos. Los centros de vacunación deben estar conectados con el Registro Central de Inmunizaciones de Filadelfia. Estamos comenzando a planificar este trabajo desde ahora mismo. Tenemos mucho trabajo por delante. Pero mientras tanto, use su máscara. Esto es necesario ahora más que nunca. El COVID-19 representa riesgos para las poblaciones vulnerables. Si usted es mayor de 65 años o tiene condiciones crónicas, usted se encuentra bajo riesgo. Y por favor, permanezca en casa. Evite el contacto con sus parientes o cuidadores que entren y salgan del hogar frecuentemente. Tanto ellos como usted deben usar una mascarilla o tapabocas cuando estén juntos. Juntos podremos enfrentar este virus. Muchas gracias.
All right, thank you, Armando. And we are now going to move to the Q&A portion for members of the media. Thank you for joining the briefing. And this first round of questions, I should say, is limited to COVID-19. So if you have questions related to the encampments on the Parkway and Ridge Avenue, please hold those questions to the second round. If your hand is raised right now and your question is not on COVID-19, please lower it and we will announce the second round when we get to it. Thank you. Joining us today shortly, we don't have them yet, but joining us will be First Deputy Managing Director Tumar Alexander and Deputy Managing Director for Health and Human Services, Eva Gladstein. Eva and Tumar will be joining us in order to answer questions related to the encampments. Only one representative from each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. Let us start off with Shira Arias of Telemundo. Shira, you're up.
Hi, yes, hi. So my question is extremely related to COVID-19 directly for Dr. Farley and the CDC. I'm going to go ahead and ask it in Spanish so that he could go ahead and translate it. So, Armando, la pregunta es relacionada con el campamento, pero es sobre COVID-19. La CDC dice que no es factible que los campamentos como estos sean desalojados debido a que podría incrementar el potencial de contaminación de enfermedades infecciosas como es el COVID-19. Entonces, en dado caso, ¿por qué van a desalojar el campamento si la CDC no lo está recomendando? So, es una pregunta directamente para Dr. Farley.
This is a question for Dr. Farley and is in connection with both COVID-19 and the camps. The CDC has made it clear that it's not advisable to remove and spread the possibility of infectious diseases, including COVID-19, by decamping the people that are gathered. How are they going to proceed, and why are they going to proceed about removing the people from these camps?
Actually, if you look at the CDC recommendations, they point out that there are other risks to people living outdoors, which are serious health risks, and those health risks need to be balanced with the health risks of COVID. And we are concerned about the health risks at these encampments. They're poor sanitary conditions. People are outside at a time when the mosquitoes that might be passing West Nile virus, and they may be passing COVID infection as well. So we are concerned about the health risks, and we think that the CDC guidelines do recognize that it's appropriate to take action under those circumstances.
Los centros de prevención de enfermedades también han hecho otras recomendaciones que incluyen las dificultades y los peligros de la gente que está viviendo expuesta fuera de techo. Nosotros tenemos la necesidad de balancear esos riesgos porque, por ejemplo, al vivir en condiciones sanitarias deficientes, ellos pueden también esparcir otros virus, como por ejemplo el virus de West Nile, y hay condiciones de salud que no se recomiendan. Por lo tanto, eso es lo que nosotros estamos balanceando en la respuesta.
Thank you. I'll wait for the second round for the other questions.
Thank you.
All right, thank you, Shiro. Let's go now to Jacqueline Lee of 6ABC.
Hey, everyone. So we're doing a story about the university starting classes again. So Dr. Farley,
Jacqueline, are you able to speak up a little bit or get closer to your
Yeah,
that's better. Thank you.
Okay. So we're doing a story about university students going back and starting classes. Obviously, you guys saw in Chapel Hill had to quickly shut down because of the cluster of cases. So I wanted to see if the city is working closely with the universities, and how are you guys making sure that a cluster of cases do not pop up and spread among the student population throughout the city?
We are working closely with all the colleges and universities in Philadelphia. We asked some weeks ago for them to each send their health and safety plan to us. We reviewed those plans, made comments on each one individually, had follow-up conversations with each one individually to try to make those plans as strong as possible. We do think that with that, we can limit the spread of the infection on college campuses. I should be clear, though, limiting the spread doesn't mean that there won't be any cases. We expect that there will be cases in college communities as there are cases in the city as a whole. Our goal is to really prevent the propagation of those, prevent the growth of those. As cases are identified at college campuses, we will be working with them on contact tracing and other steps to reduce the spread. If it turns out that we can't control the spread on college campuses despite those efforts, we might consider closing those campuses, but I'm hoping we won't get to that point.
And do you feel like classes should be returning in person? You know, I mean, they're 18-year-olds, right? They're all excited to party and go meet each other. But if the cluster of cases starts to pop up, could that eventually spread to the general population of Philadelphia?
Well, the virus is already in the general population in Philadelphia. The real question is, will having more of these students in the city increase the risk to the community as a whole? I don't know that is likely to occur, given all the safety precautions that these colleges and universities are putting in place. That doesn't mean that everybody's going to follow every rule all the time, as you've seen about the block parties that are occurring in the city. But we do think that the colleges and universities have plenty of opportunity to set standards for safety practices, and we'll work closely with them. If things aren't working, we can change, but we're comfortable with where we are right now.
Thank you.
Thank you, Jacqueline. Let's go now to Jack Tomzik of Metro.
Hello, this is for Dr. Farley. You said that testing has increased, and now the city's doing, the city residents are getting tested about 3,000 times a day. Can you quantify that increase? How much is that compared to, a few weeks ago or last month? How big has the increase been in testing?
A few weeks ago, we were averaging about 2,500 tests per day. And so you can calculate the percentage increase. We are on a long-term increase. If you go back to April, When we were at the peak of the epidemic, we were about 1,200 tests per day, so substantially higher than that. And those, you do need to take that into account when you look at the daily case counts. The more you test, the more cases you will identify.
Yes, and I wanted to ask about that. You said the positivity rate for the past week is 4.1%, right? Is that what?
The past week is 4.0%. It was
4.0.
4.1% the week before.
Okay. All right, thank you. Those are my questions.
Thank you, Jack. Let's go to Natasha Brown of CBS 3.
Hi, this question is Dr. Farley. It's just in reference to the state health and Dr. Levine earlier this morning, again, reiterating that the state is requiring that all students in a school setting, in an in-person setting, have their mask on the entire time, despite the social distancing outside of eating and possibly some breaks throughout the day. I know that Philadelphia schools obviously are going to be all virtual, but there will be some in-person school settings with archdiocesan schools and things like that. Also with pre-K and the access centers that are going to be set up for students in the city that really need to be in a setting where they can be supervised throughout the school year. How will that work in that situation, in those situations?
So we likewise have recommendations that students are wearing masks at all times, with the exception of meals and then maybe occasional mask breaks, which are very carefully done so that they're not near to other students at the time. We think that that's the most important single thing that any school can do to prevent the spread of this virus in a school setting. Now, that's not going to be easy as you get to the youngest children. So we recognize that it may be difficult for pre-K children. They should have that done as much as possible. And it certainly are. I have seen pre-K children myself who are able to wear a mask all day. Not all of them will be. The more they can have wearing a mask, the lower the risk for everyone.
Okay, thank you. That's all for now.
Thank you, Natasha. Let's go to Martin Pratt of Philly.gov.
Yes, this is for Dr. Farley. The Yale study that showed a new possible test as far as a saliva test. Can you speak to that?
I'm not sure what study you're talking about, so can you tell me a little more?
Sure. A group of Yale students got together and got funding for a faster test. And there was a study done about the saliva test. So you could theoretically do it at home.
Yeah, there are a number of people, a number of companies that are developing tests that would be quicker and, one hopes, more accurate. So far, nothing has been brought to market and has gotten approval from the FDA that is both rapid and has a high level of accuracy. We wish we had that. And as soon as one comes along, I'm going to be very enthusiastic about promoting it. But at the moment, the ones that have been rapid have not been very accurate.
Secondly, can you speak to the increase by geographical location? Do we see the increase in cases? Is it neighborhood? Is it area?
We're seeing it all over the city. In the past week, we saw more in the sort of near north section of the city than we saw elsewhere, but there were certainly cases everywhere. And so when we do see that, then we see if there's any way that we can provide additional services or communications to that neighborhood to try to limit the spread in that area. And we have a map on our website, I believe, that shows the location of cases in the past 2 weeks, so everybody can get a sense for where this is circulating.
Thank you.
Martin, you good?
Yes.
All right. Let's go to Laura McChrystal of the Inquirer.
Hi. First, I have a question on indoor dining. I understand that previously you all had mentioned that an announcement would be made by August 21st, which I think is Friday, about allowing indoor dining. Will that still be true? And what factors will you be looking at to make that decision?
We will have an announcement by Friday, if not earlier. And we're looking at the case rates and the trend in case rates, whether they're rising or falling. We're looking at our contact tracing information to see where the disease is spreading. We're looking at other metrics that we put on our website, which I can't find the exact page, but I can direct it to you, that overall give a sense for how strong our response is. Okay.
And I also have a question about trash and recycling collection, I guess for the mayor. Mayor, you've mentioned on previous Zoom calls with these briefings that, we're in previous weeks, like they're back on track, things are getting back on track. Yet then this week there are delays again. What is a realistic timeline for the city to actually be caught up at this point?
Realistic timeline is when we no longer have about 200 employees calling out either sick or COVID-related excused absence every day. When we can get our crews back up to over 200 from an average of 160 or so a day now, and on the weekends less, when we can get that up to speed, which we're working hard to do by bringing on approximately 120 to 130 new employees. I will tell you though, and people get angry when I say this, but the neater you put out the trash, the easier it is to pick up. Recyclables put in a paper Acme bag at the curb in the rain makes it extremely difficult to pick it up once it's wet, which leads to it spilling out onto the ground and either leaving an unsightly mess or having the worker have to scramble with his or her hands to put the stuff in the truck. So if you can keep your trash in a can, bag your trash and put it in a can, and then use your recycle buckets, we provide from the city to put your recyclables in, it makes it much easier for workers to pick it up. We are approximately a day behind now. We're picking up yesterday's trash today and folding into tomorrow. We don't know how many crews we have until about 11 o'clock. So as soon as we we have about 180 today. As soon as we're consistently towards 200 or over, we will catch up. And people can help us by being a little neater with putting out the trash, listening to the days when we say to put it out, and not putting your recyclables in containers that will melt in wet weather, which we have a lot of in August because we have a lot of wet weather in August.
Okay, thank you. That's all from me.
Thank you, Laura. Let's go to Kennedy Rose of the Philadelphia Business Journal.
Hi, I have two quick questions for Dr. Farley. I was wondering, there are a ton of local companies working on vaccine development, and I was wondering if you've heard any updates from them in terms of vaccine development and any trials happening.
You know, there are so many different vaccines that are being developed that I've lost track of them, and there may be some that are being developed by companies in the local area. I'm not familiar with all of them. They are not among the three that are really the closest to the finish line. I can only say that much.
Gotcha. And what sort of role, I know that this is decently far out, but what sort of role can local companies play when it comes to vaccine rollout when that does happen?
You know, I'm not thinking of a key role for companies other than companies that have occupational health clinics, so that may be a site in which the vaccine is offered.
Okay, thanks very much.
Thank you, Kennedy. Let's go to Pat Loeb of KYW.
Dr. Farley, the outline you gave for how a vaccine would be distributed, is that pretty much what you'll be recommending to the CDC by October 1st? And do you know why the city was included in that planning?
Yeah, so for those who don't know, Philadelphia was chosen along with 4 different states to pilot a planning process. I don't know exactly why Philadelphia was chosen. I can tell you that I'm sure that they wanted a diversity of types of locations. And so they have rural areas like North Dakota on there. They also have California, which has quite a diverse population. And I think that they want to have a city. And then Philadelphia also has a very strong immunization registry. We're quite proud of our immunization registry. And so that is makes something to build on for here and an example to use elsewhere. And what I described now, I think is pretty much the model that all are going to follow. There's many, many details to be worked out within that general description, though.
Thank you.
Thank you, Pat. Let's go to Carolina Rodriguez Plaza of Univision. Carolina, you'll have to unmute yourself. There you go. We're set.
Hi, everyone. Can you hear me now?
Yep.
Okay, thank you. I have 2 questions related to COVID-19. I'll need Armando to help me out with Dr. Farley, please.
Yes.
Buenas tardes.
Hola, Armando. I would like a first reaction about the COVID Alert PA that Dr. Levine announced today for the COVID app, and also if this is going to work if you merge it with the contact tracing project you have in Philadelphia, how these two can be related or merged in order to provide a better understanding in the population of COVID-19.
The question was in English, so I think
Disculpa, Armando.
Dr. Farley can proceed if you want to with the answer.
Okay. So there is an app that people can download on their phone, which was announced today by Secretary Levine, that can assist with contact tracing. The way that the app works is that if people have it on their phone and have it turned on, and someone is identified as a case, and that person can send a message through that effectively so that the other phones that were in proximity to that phone send a message to their owners that it looks like you came close to someone who has COVID infection. And so then you should be in contact with the health department, or you should be quarantined and tested. I haven't seen the app myself. It is just being rolled out today, but that's the basic idea. We see this app as potentially an important adjunct to the contact tracing efforts that we're doing. Our contact tracing right now involves people calling someone with infection, having them remember their contacts, and then give us the phone numbers of those contacts, and we make those phone calls to those contacts. That's great for the people that they tell us about, but there may be people that they're unaware of who they were exposed, maybe even strangers that they were nearby, and this exposure notification app may be able to assist in that. It only works if people have it on their phone and they have it turned on. And so we're all going to learn about how it is rolled out, how people accept it, and how many of the people are actually using this. So we don't know how important an adjunct it will be. We hope it's an important adjunct to our contact tracing.
Yeah.
Este es un aplicativo que la gente tiene que bajar a sus teléfonos, que ha anunciado la secretaria de la Salud de la Mancomunidad, Levine, para ayudar con la búsqueda de contactos. Y se tiene que tener en el teléfono, en el cual, en el caso de que alguien resulte positivo, les envía un mensaje de texto, y esto contacta a las otras personas que tengan esta aplicación en su teléfono, que hayan estado en proximidad con las personas. Parece que va a ser algo que nos va a ser muy útil, y obviamente es algo que se tiene que llevar a la persona luego a que esté en cuarentena, o que se le examine y se haga una prueba para ver si realmente está cumplido por exposición con la persona final. No he visto la aplicación porque recién se ha anunciado el día de hoy, pero creemos que va a ser una herramienta útil y adjunta para nuestros esfuerzos de poder buscar a los contactos y encontrar a las personas. Lo que estamos haciendo ahora, sin tener esa aplicación, es llamar a la gente y pedirles que recuerden con quiénes estuvieron, que nos den los números de teléfono de esas personas para poder nosotros contactarlos. Pero lo que sucede a menudo es que las personas tal vez no han estado conscientes de quiénes estaban al lado de ellos, o no tienen la información, o son extraños. Entonces creemos que ese aplicativo nos va a ayudar con ello, y solamente funciona, sin embargo, si las personas lo tienen en su teléfono y lo tienen encendido en todo momento. Así que queremos ver cómo funciona y esperemos que sea una herramienta útil en esta lucha. Gracias.
Caroline, are you all set?
For the moment, yes. I have another question for the panel. I'll wait. Thank you.
We'll circle back. Let's go now to Julie Hancher of Green Philly.
Hi, thanks. I have another question about trash and recycling, likely for the mayor. A lot of residents are reporting that trash and recycling are going into the same truck. And also, I talked to a sanitation worker this morning who was also combining the trash and recycling. Neighbors are also posting on next door in order for recycling to be picked up to suggest even combining those into trash bags, just putting the recycling in the trash. What would you suggest to residents who do want to recycle, or what is that current status?
I would maintain the recycling in the buckets in as neat a way possible. One of the ways that I do it myself is by taking boxes and ripping the sides off the boxes and folding them so they fit into the recycle buckets better. And even if the recycling gets wet in a plastic recycling bucket, we can still empty it. I don't know whether or not the cardboard is still valuable after it's wet, but we've had, again, 3 major storms in the last month. So I would try to keep it as neat and compact as possible. These incidental issues relative to, or anecdotal issues of trash being combined with recycling, I don't doubt that it's happening. But if we have an idea where that's happening, we can put an end to it, or at least re-educate the worker, the employee, not to do that. I don't think it's happening widespread, but a lot of this is anecdotal, and we will try to respond to the anecdotes as best as possible and continue to plow on as we catch up.
Do you have a percentage of what, or do you know what percentage of recycling is actually being recycled or being combined with the trash?
Don't know, but I could find that out from our deputy commissioner for sanitation.
Okay, thank you.
Julie, if you email the press, we'll try to get that for you. And let's close off. Thank you, Julie. Let's close off the first round by going to David Melandra of the Sports Network. David, you're up. David, I'm not hearing you. All right, let me try unmuting you again. Go ahead. Now try unmuting yourself. There you go. Can we? All right, we are not hearing you, David. So maybe if you log off and log back in, we will get to you. Let us now move to a second round, including questions on other topics. And as I mentioned earlier, joining us today is Deputy Managing Director Tumar Alexander and Deputy Managing Director for Health and Human Services, Eva Gladstein. And we'll be able to answer questions you may have related to the encampments. And let's go first to Annie McCormick of 6ABC.
Hi, can you hear me?
Yep, go ahead, Annie.
So we're at the encampment right now. Obviously, the deadline is coming past. The encampment is still here. A couple things. We're hearing that there's a 2:30 either conference call or hearing in regards to the federal injunction that was filed on behalf of the people that have been living here at the encampment. Can you confirm that that is happening? And what are you doing? Are you going to remove the encampment today?
First of all, it's not a deadline. We have the requirement to post, and we posted 30 days ago. I stopped it. I stopped the end of the encampment so that we could have an opportunity to have further conversations, with myself included. On at least two occasions, I attended the meetings. Since that period of time, we've been able to place 90 people in housing, shelter, residential treatment, or other housing options, which includes hotel rooms with private bathrooms in our COVID prevention spaces for people age 65 or over with underlying health conditions. During the course of our conversations, we've agreed to at least 20 different requests of the group, more than 20 actually. And their response basically is, unless we meet all of their demands, they're going to stay there forever. We've had people move out of the encampments voluntarily, constant fighting outbreaks and violence and other safety concerns with the prevalence of drugs and public defecation, recent hot weather, and serious storms. That's a growing concern. The conditions have deteriorated significantly. We've received more than 400 complaints from residents both around the Parkway and in North Philadelphia. And the North Philadelphia site is delaying the development of a supermarket for the neighbors up in that neighborhood that don't have a supermarket at the moment. What I said was that we want to resolve this in an amicable way, and we are making every effort to do so. But you can't negotiate with someone or people who don't want to give and take. They filed in federal court today that the injunction is not necessary. I don't believe it's been issued. I believe there's a hearing on an injunction request, and I don't know what the time of today that hearing is, but the law department will attend and basically explain to the judge what we've been trying to do. We don't have a requirement to vacate the encampment today. We had a requirement to post it to notify people that if they wanted to move, they could move their supplies and their belongings, which we will hold in a warehouse for 30 days with their name tagged on it, so they can recover those items at a given time. Look, I agree with their desires to end homelessness. We all want to end homelessness. There are certain things they're asking for that the federal government and state government needs to do that we can't control, but we'll work with them to get it done. But at some point in time, this has to end because it's not tenable and it's not sustainable. And I think we've done everything we can to meet them at least halfway and more. And apparently that's not where they are at this moment. And we will take appropriate measures once we're through with the court hearing and hear what the federal judge has to say. But Jeff, of the 400 complaints that we're getting, in addition to the supermarket being held up, there's lots of activities on the Parkway that the people in the community take advantage of, including recreating their kids and a long-standing sports league that's been delayed for the summer and now is in danger of being delayed for the fall. I empathize, I sympathize, but we have to come halfway with all of us in order for us to move forward.
And Eva or Tumar, did you have anything you want to add? Although the mayor certainly covered a couple of points there. I think we're good. All right. Annie, did you have anything else?
Yeah, I have one follow-up to that, Mayor. What you're expressing sounds very along the lines of the people that are frustrated as well with the encampment and the residents here. But you have the power to shut it down right now. So I think the question from the people that are frustrated is, why can't you just have them removed today?
Because we had 2 council members who asked to see if they could take another run at the issue. I think there was a meeting today. I don't know the results of that, but we gave them the courtesy to see if they could intercede. I don't want a confrontation. Was never looking for one, and hopefully we can resolve this amicably. There's no requirement for us to end the encampment today. We had posted 30 days ago. I entered into this conversation personally to see if we can come to an amicable solution. It doesn't seem like it's going in that direction. We reposted today to give people notice that we intend to end the encampment, and hopefully something happens positive, but if not, we're going to end the encampment.
All right. Thank you, Annie.
Thank you.
Thanks, Annie. We are down to the 10-minute mark and have a number of people with their hands raised. So I'm going to ask if you could limit your questions to 1 or 2. I would appreciate that. David Melandra couldn't get through earlier. Let's give you another try, David, of Philly Sports Network. Unmute. Go for it. Are you there? David, I'm still not hearing you. All right, let's move on now to, let's go back quickly to Martin Pratt of Philly YBN.
Yes, this question is, or comment is for the, or it's a question, I guess, for the mayor real quick about this comment about recycling. Is it true that we can put recycling in a clear, large plastic bag, and that's amenable?
Yes, as long as there is, well, I really don't know the answer to that question. It would be certainly neater than putting it in a paper supermarket bag or a cardboard box. But I'll give you an example. I mean, driving up Broad Street yesterday in South Philly, trash was picked up. There are big belly trash cans, for example, on a number of corners in South Philadelphia. They are littered with little, plastic bags of trash that people leave their apartment or house every night and place it in piles around these big belly trash cans. I mean, we cannot clean that street every day. People need to keep that trash in their freezer like I do, and then put it out on your trash day. For example, there must have been someone a couple blocks north around Federal or so that moved out of an apartment. They took a sofa, dumped it on the sidewalk, along with big plastic bags of things that they apparently didn't want to take to their next apartment or house, and left it there as a short dump. That does not mean that the city's behind on that trash day or on that trash pickup. It means that somebody dropped a large load of trash in front of their former apartment a week or so before trash comes around the next week. So it's just, look, we are behind for sure, and we're catching up, and we're trying to get our people back to work who are sick or who are exhausted. But some help from folks putting out trash in a neater way and not short dumping their trash on a non-trash day will help us get where we need to be in a quicker period of time. But we'll get the plastic bag. I don't know.
Thank you.
All right.
It would certainly keep it from scattering.
Thank you, Martin. Let's go back to Carolina Rodriguez Plaza of Univision.
Hi again. Sí, Armando, mi pregunta es relacionada a los campamentos y sé que el alcalde dio una explicación extensa a la colega de 6ABC, pero sí quisiera sus expresiones o algo relacionado al tema en español sobre qué va a pasar con estas personas que están en el campamento en el Ben Franklin y en el Azalea Gardens y en los demás que se han conformado en la ciudad.
Muy bien, gracias. This is a comment for the mayor, or a question rather. Our colleague has heard what you've mentioned to the other journalists, but she would like to have your words to the community in regards to what you intend to do with the camps in the Ben Franklin Parkway, the Azalea camps, and elsewhere in the city. What's going to happen to them, and what message you have to them?
We intend to continue to work with people as much as we can to get them into a safe shelter or safe housing situation, whether that's drug treatment or any type of shelter we can get them into. There's going to come a time relatively shortly where we're going to run out of words to talk to each other about. We're not going to meet all the demands that the encampment leaders want us to meet. We're willing to meet over 20 of them. And there are things that the federal government and state government has to agree to before we can accommodate them. The conditions within the camp are getting worse and worse. They're getting less healthy. They're getting more violent. They're getting more filled with drugs. They're getting more unhealthy from a human, human excrement and human, bodily function situation. And it's just not sustainable. While I agree with them relative to housing policies nationally and trying to get more people into housing, I'm working on that all the time. But we cannot allow, a supermarket project to be delayed or maybe go away because a deadline is passed, or what's going on the parkway to continue because it's not safe and it's not healthy. We have a responsibility to everybody.
Thank you.
La respuesta que nos da el alcalde es que nosotros tenemos la intención de continuar trabajando con la gente para encontrar un refugio seguro y alojamiento que incluye también el tratamiento contra el uso de drogas. Pero en estos momentos vamos a quedar sin mayor diálogo posible porque no podemos acceder a todas las demandas que nos han hecho. Nos hemos reunido y hemos satisfecho al menos con 20 de ellas. Y estamos de acuerdo con que es una política que tiene que ver a nivel estatal y a nivel federal también. Las condiciones en estos campos, sin embargo, se están empeorando. Hay incidencia de violencia, hay incidencia del uso de drogas y, por supuesto, hay más residuos y hay restos como excrementos. Y esto no es sostenible en el tiempo. Nosotros estamos de acuerdo con que tiene que haber un cambio de política a nivel nacional y estamos trabajando en ello. Pero no podemos permitir que, por ejemplo, un proyecto de construcción de un supermercado se demore porque no se satisface un plazo que se había dado anteriormente. Nosotros queremos encontrar una solución sostenible y una solución segura. Y estamos trabajando en ello. Gracias.
Gracias, Armando.
Thank you, Carolina. David Melandra was still having audio problems, but texted me his question. It's for Dr. Farley. It's a follow-up on Dr. Farley's comments of last week regarding the Eagle season and their home opener on September 20th. Question, do you believe at some point that Eagles fans could be in the link for the 2020 NFL season, perhaps in November or December?
I said very unlikely that we would have fans in the opener on September 20th. It's a long season. I'm not willing to speculate what happens over the duration of the entire season.
All right, thank you for that. Let's go now to Sean Walsh of the Inquirer.
Thank you. Question on the encampment for the mayor. Your office said last night that there was a verbal agreement with the organizers, but it seems there was a difference between your administration's expectations of what that agreement was and what the organizers drafted in their MOU. So
I have no idea about a verbal agreement.
Yeah,
unless Shamar, Eva, that's news to me.
Sean, I don't think we've ever said that. I'm not sure you're getting that.
Sorry, misunderstanding. I'm gathering questions from other reporters. What are the main sticking points, I guess is what I was getting at, between what you guys are willing to do and what you have done for, to their requests and what they're still demanding?
Well, there's a long list of things that we've had conversation on. We'd be happy to talk with them offline. But one of the main sticking points is they want us to turn over houses that are currently vacant and basically unlivable because they have no plumbing, electricity, or other amenities to turn them over. We don't even have a problem considering turning them over or having that conversation, but we can't do that without other governments agreeing to it. And it's just not within our jurisdiction to be able to turn over properties that either state has control or the federal or HUD has control over to do that. And it's not safe for people to live in properties without running water, without plumbing, and without electricity. And that's what we were trying to work through. But when you're told that in a negotiation, you either give us all of our demands or requests or nothing, you come to an impasse.
Thank you.
All right, thank you, Sean. And Eva or Tumar, did you have anything to add with regards to the negotiations? Are you good?
This is Eva. I would just add that they want permanent housing immediately for everybody at the camp, but we have not been able to identify the number of people there, the number who are homeless. And again, our permanent housing options are limited. And what we've offered instead are pathways to permanent housing. as thousands of other people take advantage of every year. But they've asked for something immediate that we cannot produce.
Okay, thank you, Eva. And finally today, let's go to Kelly Rule of Fox 29.
Hi there. So I have two questions. I'll just ask them all at once. First of all, so was there a meeting with encampment representatives and city officials today, or was the council members' decision to get involved the main reason that this discussion, I guess, is still ongoing at this point?
Well, we wanted to give the council members the opportunity to they have contact and history with the folks at the encampment, and we wanted to give them one more chance to try to end this in an amicable way. I mean, I don't know what else we can do. We've gone 30 days longer than the last posting, and I don't know what people expect. This is public land, and all people have a right to it, and you can't live on public land indefinitely without plumbing and all the amenities that you need in order to live sanitary. It's just the way it is, and Tumar could answer the other parts of the question.
Yeah, Kelly, I was just going to verify that there is a conversation that we started a few hours ago with the council members and the encampment organizers. That conversation is still ongoing. Even with participants, and plan to potentially go back and continue those discussions.
Okay, thank you. And has a new date and time been set to try and get to either, I don't know, forcibly is the right word, but to get the group to leave, possibly in the overnight hours later this week?
We've had the requirement to post. We are now in court. We have to find out what the federal judge will opine. We will certainly abide by whatever the federal judge orders us to do or doesn't order us to do. And we don't have a specific date. It's imminent, but I don't have a date and time for you. Again, we posted yesterday, received the input from the council people last night and this morning, gave them the opportunity to intercede. We are now in federal court as the encampment attorney filed a federal court and request for injunction. We'll see the results of that, and we'll move on from there.
Thank you.
No plastic bags in recycling, Martin. Sorry.
Did you get that? Yeah, thank you. And thank you, Kelly. That is the last question, and which works out well since we are out of time. Thank you for joining us, and we will have the next briefing on Thursday at 1 p.m.